Hi all. In this video, we will see some desensitizing toothpaste and its mode of action. Before that, let us look at some clinical conditions that cause sensitivity of tooth. Recession is one such clinical condition where the dentin is exposed to the oral cavity. So this condition is caused by improper brushing habits or improper oral hygiene. So that leads to the apical migration of the gingival margin. So the second condition is accretion. So if you look at the lower incisors, the incisal edges are accreted. So enamel is worn out, leading to the exposure of the dentin. So this particular condition is caused by occlusal overloading, and it is also due to parafunctional habits like bruxism. So the other condition is abrasion. This is mainly because of overzealous brushing of the teeth. The enamel are worn out and the dentin is exposed. The final condition is erosion, wherein this particular erosion is caused by excessive consumption of acidic beverages or carbonated drinks. So there is this theory which is proposed by Brandstrom 1963, the hydrodynamic theory. So according to this theory, the exposed dentin has dentinal tubules. These dentinal tubules has odontoblastic process which is in connection with the nerve endings of the pulp. So whenever a patient is exposed to cold drinks or hot drinks or cold air, fluid movement occurs in the tubules, dentinal tubules, which in turn will stimulate the odontoblastic process and stimulate the nerve endings. And the patient starts feeling sensitivity of this teeth. So to counteract that, there are two methods. One is nerve stabilization. The other one is occlusion of dentinal tubules. Nerve stabilization, we have potassium nitrate. This particular compound will cause depolarization of the nerves. The other mechanism is by the use of compounds that will precipitate or occlude the dentinal tubules. So examples are strontium chloride, potassium oxalate, stannous fluoride. So these compounds are present in various commercially available toothpastes, and the patient has to use it for at least 2 to 4 weeks to feel its effect. So these are some commercially available toothpastes. For example, we have Colgate Sensitive, Senquil F, RA Thermosil. So all these toothpaste, they have their active ingredient as potassium nitrate. Pepsodent Expert Protection has potassium citrate as its active ingredient. So these compounds will help in nerve stabilization and prevents or reduce the sensitivity of the tooth. And certain commercially available toothpaste are there like Colgate Sensitive Pro Relief, Sensodyne Rapid Relief, and Thermosil. So these will help in the precipitation of the dentinal tubules. Colgate Sensitive Pro Relief contains 8% arginine and calcium carbonate with sodium monofluorophosphate, and Sensodyne contains strontium acetate with sodium fluoride. Thermosil contains strontium chloride. So all these salts actually helps in the precipitation of the dentinal tubules and occlude the dentinal tubules, thereby preventing the sensitivity of the teeth. So ADA, that is American Dental Association, seal of acceptance is present for Sensodyne. So this particular Sensodyne flushing pack, this particular toothpaste has 5% potassium nitrate, so which helps in nerve stabilization and thereby prevents sensitivity of the tooth. There are different technologies employed in toothpaste, like pro-origin technology and Novomin technology. So these helps in the occlusion of dentinal tubules. Colgate Sensitive Pro Relief operates by pro-argin technology, which has 8% arginine and calcium carbonate with sodium monofluorophosphate. Whereas Sensodyne Repair and Protect operates by Novamin technology, which consists of calcium sodium phosphosilicate in sodium monofluorophosphate, and that helps in the occlusion of dentinal tubules. So both Colgate Sensitive Pro Relief and Sensodyne Rapid Relief are proved to be effective for reducing the sensitivity of the teeth. Thank you.